How are y'all? I'm good, thank you. Clearly we're on the cusp of a King v. Burwell decision. And we're introducing today what we call the Patient Freedom Act, which is a Republican response to what quite likely will be a Supreme Court decision in favor of a plain reading of the law, which is that the subsidies that the Obama administration has been giving to those on the exchanges should really only go to those who live in states in which there are state exchanges. Plain reading of the law. Now, I think it's wise to take a few minutes to review the current status of the law and then kind of my reason for and method by coming up with an alternative, and then I'll discuss that alternative and take whatever questions you have. My gosh, I saw a latest CNN ABC poll. The popularity of the law is down to 39%, which is kind of the Democratic base. And it's important to ask why. I would argue first it is coercive. It is not an American value to be told what to do by the federal government, and if you don't bend to the will of the federal government, you shall be penalized or there shall be some other sanction against you. Americans don't like that. We're about freedom, not about being told what to do. Secondly, there is the cost of the bill. I notice the president likes to conflate health care cost with premiums. Now, there is a graph in which it shows that before the health care law passed, the rise of health care cost was decreasing. And normally there is a connection between the cost of a premium and health care cost. There is no connection now. Health care costs are flat and premiums continue to rise. So what Obamacare, and that began in 2009. So what we've seen is that the health care law has disconnected health care cost from premium cost, which is to say that now, because of the law, health insurance companies have a lot more expenses aside from taking care of patients. That is a very bad side effect. I had some headlines, which I think I've now misplaced among all my papers, but in the headlines it speaks of, it quotes you. It quotes you as to the latest set of premium increases that have been announced for this coming insurance year. In some places as high as 60%, routinely over 10, 20, and 30, all commonly heard. Now, this has resulted in those who are not receiving a subsidy unable to afford insurance. And we should also point out the insurance that many are buying have $6,000 deductibles. Now let me kind of transition to the kind of way I started my alternative. I've been working in hospitals for the uninsured for the last 25 years. And I have a small private practice, and I still see patients. I actually had to step out of policy lunch to take a phone call from a fellow physician as regards management of a certain patient. It is something I have lived. And you find that, one, women make most of the decisions regarding health care for their family, number one. And number two, they will tell you that their values of their pocketbook are intertwined with what they wish to do with their health. Women are upset. They have found, as one woman told me 3 years ago, I was paying $12,000 a year for a policy for my husband, myself, and my two sons who are 18 and 19. And now I'm paying $22,000 a year. By the way, it has since risen to $25,000 a year. It's now $25,000 a year for my husband, myself, and my two sons. I said that on the campaign trail. Washington Post wanted to fact-check us. They fact-checked us and found out we were absolutely right. She went on to say, by the way, she's 57, her husband's 58, and unless her name was Sarah and his was Abraham, they did not need obstetrical services. So what we've seen is that the cost of premiums have risen, not for that which directly relates to the care of that particular patient, or not even reflective of their will, rather something that a Washington bureaucrat has told them that they have to have. Working in a hospital for the uninsured, I have found that whoever pays the bill has the power. And if the patient has the power, the system aligns to serve her. If it is a bureaucrat that has the power, the system aligns to kind of serve whatever the bureaucrat thinks that the patient needs. In our Patient Freedom Act, we give power to the patient. So let me kind of go over what we're doing with this. In the Patient Freedom Act, again, we give power to the patient. We do that we begin to do that by lowering cost. We lower cost by repealing the individual and the employee mandates. And we give credits to the patients, either directly from the federal government or through the states, which goes into a health savings account, which the patient will receive. This is patterned after Healthy Indiana, in which for their Medicaid recipients they set up HSAs with which the person could purchase health services. The patient, she can either use it directly to pay for a patient service, or she can use it to, either use it to purchase insurance or to contract with a physician group. And if she does nothing, or if he does nothing, the state would have the option to arrange it so that the patient is enrolled unless the patient chooses not to be. We think by this, you end up with about 95% enrollment. You do this without mandates and without penalties, consistent with American values, but also consistent with the values I have as a physician, which that everyone should have access to care. And we believe that through this, she will have access to care. We further lower costs, we repeal the mandates and the essential health benefits, we return jurisdiction over health insurance back to the states, who had it all the way up until 2009. And we allow those who are closest to the patient to decide what benefits the patient has to have. It is a principle that he or she who governs best governs closest to those governed. We return that to those patients. Lastly, we give the patient the power. We give the patient the power to change plans, portability. We give her protection against pre-existing conditions. And lastly, we give her the power of price transparency. Nirvana for me would be that if the doctor orders a CT scan, the mom can take her smartphone, scan a barcode. Oh, the CT scan costs $250 here or $2,500 there, and the quality is the same. I am going to go to the place where it costs me $250. I chose those two numbers, by the way. The Los Angeles Times had an article a couple years ago, shout out to anybody here if they're from the Times, which showed that the cost of a CT scan in the LA area varied between $250 and $2,500. And the patient would never know. It took that investigative reporter to know. We want the patient to know that. We want power to go to the patient. Price transparency gives her that power. By the way, price transparency also lowers cost. I have children. My wife, she buys jeans. She makes some calculation between quality, convenience, and price. We want patients to have that same ability to do that when it comes to health care.